Okay, what's up guys? My name is Dr. Ling, consultant pediatrician at Thomson Hospital, Kota Damansara in Malaysia. Okay, today I would like to tell you a true story, a heartbreaking story about one of my patients. Okay, one evening at about 6 p.m, the emergency department called me to see a very ill child who was brought into the resuscitation area. Well, I was already on my way home and had to make a U-turn back to the hospital. This patient of mine was an 8-year-old girl, okay, let's call her Sue, who had been having persistent fever and cough for the past 5 days. Sue was seen earlier by a general practitioner and was asked to be admitted to hospital, but only came to hospital 2 days later. On checking her, Sue appeared to be blue and very breathless. Her oxygen saturation was only 60%, when normally it should be above 95%. Even with a high flow mask, the oxygen saturation could only reach 69%. She was restless, well in fact delirious, probably due to the low oxygen level and accumulation of carbon dioxide in her body. On examination, the chest, there was hardly any air entry into her lungs. We proceeded to intubate and put her on the ventilator. But even with full support, her oxygen saturation remained about 80%, well below normal. By then, we knew the outcome would be grievous. We did a chest X-ray. A normal lung should be filled with air, which appears black on the chest X-ray. In Sue's case, her lungs were completely wiped out, except for a small part in the upper zones of the lung. What Sue had was a lung infection, also known as pneumonia, which had spread through the bloodstream to her whole body, a condition we call septicemia. We started her on the strongest antibiotic we had, but she continued to deteriorate and tragically succumbed to the infection around 6 hours after admission. Within 24 hours, Sue's blood culture grew a bacteria. Do you want to know what bacteria caused Sue's death? The name of this bacteria was pneumococcus. Okay, remember this name, pneumococcus. In Greek, pneumo means lung or breath. It is currently the commonest, I repeat, the commonest germ causing lung and brain infection. Globally, pneumococcus kills 1 million people annually. That's around 2 persons every minute. Pneumococcal infection shares many similarities with COVID infection. Firstly, both affect predominantly the lungs. Both can also potentially spread to cause multi-organ damage. Secondly, both pneumococcal and COVID can be prevented with vaccination. Since December 2020, the pneumococcal vaccine forms part of our national immunization program. It's free of charge at government clinics. We encourage every child to take the vaccine. For those born before December 2020, they can get the vaccine at private clinics or hospitals. The vaccine is also recommended for the elderly above 65 years old. For COVID vaccination in Malaysia, the authorities have allowed walk-ins for adults who are unregistered and those who have yet to obtain their appointments to take the COVID vaccine from 1st August 2021. Thirdly, both pneumococcal and COVID infections can cause death. While COVID causes death among the elderly, relatively sparing the young ones, pneumococcus causes death in both young and old alike. Okay, back again to the story about my patient, Sue. Breaking the bad news to her mother was the hardest part. I just cannot imagine the trauma and pain the mother had to go through losing her child like this. Being a parent myself and also having a daughter about Sue's age at the time, I would not be able to bear the devastating experience of my child dying. As doctors, we are trained from university days to maintain a professional distance from our patients. We are supposed to keep our composure, show no emotion, and be unaffected. This stereotype for doctors can best be exemplified in movies. The typical scene is one where the loved ones of the patients would be waiting anxiously outside the operating theatre. Suddenly, the theatre door swings open and out walks the doctor. As the patient's loved ones gather around the doctor and ask how the patient is, the doctor, still in his operating gown, will pull down his mask, look glumly, mutter some words, shakes his head, and walks away, leaving the loved ones helpless and in agony. Doctors, you don't think that's how you are? But that's how the public and those in Hollywood or Bollywood perceive how doctors are. But the more I practice medicine, the more I recognize this maintaining professional distance thing cannot be true. Well, at least when it comes to death and dying. For healthcare workers in the front line of the COVID pandemic, the number of deaths you see is simply staggering. But I would like to urge you to continue to feel for your patients and their loved ones. Never allow your feelings be numbed by the deaths around you. It is only by feeling for our patients can we truly be in touch with our humanity and what it means to be human. Yes, grieve for our patients who die. Feel for the loved ones, but do not languish in that state. Rise up again and continue to do what we do best, that is to save lives. For every death that brings sorrow, there will be many lives saved that brings happiness and encouragement. Keep at it! Never give up. We are the generation of doctors that will make a difference in the lives of our patients. My heart also goes out to those who have lost a loved one to COVID. Words cannot express the sorrow and anguish I feel for the family. If you know a close friend who have lost a loved one, do not just send condolences or say words like, "He's in a better place. Be strong." Share their sorrow. Be available for them by keeping in touch, offering a listening ear, and help regularly. Okay, that's it for this segment. Stay safe and do take care, and continue to have a heart for kids.